Hi, my name is Dr. Damian Rogers. I'm a chiropractor. I've been in private practice for 10 years now here in Tampa, Florida. We offer spinal decompression, spinal care, therapeutic exercises, and now as a new tool to help eliminate acute and chronic pain is manipulation under anesthesia. It's a non-invasive, non-surgical technique to where we can increase range of motion, eliminate pain, and decrease fibrotic adhesions and scar tissue. It's kind of like rebooting the nervous system, rebooting the computer of the nervous system so we can retrain the body to alter its function back to a normal state.
I've had pain off and on for over 20 years. The doctor at that time asked if I wanted to have surgery done on my neck because it was so bad at that point, and I said, no, I'm not going to do surgery. And I'd like to be able to get back to doing a lot of yard work. I'm part of a disaster team, so when we have hurricanes or tornadoes or anything like that, then we take our chainsaw trailer out, and I want to be able to do that again without having a lot of pain and limitations because of that.
Basically, we're taking the cervical spine through its range of motion in the 6 different planes. When the patients have so much pain over a certain number of years and months, they develop scar tissue, and that restricts their range of motion. So when they're awake, the scar tissue is so painful that they will not achieve full range of motion. But under sedation, we can rearrange and break through all that scar tissue to allow that range of motion to be full. And if you don't have full range of motion of the extremities, your lower back doesn't work like you're supposed to. Your pelvic becomes tilted because of the lack of range of motion. Your hamstrings are pulling on your pelvis. So you develop chronic back pain because of bad posture and bad mechanics on ambulation.
Did you feel some improvement, or do you know something's happening?
I can tell something's happened. My right side was a lot looser. My left side is still pretty tight, but it's getting there. Okay. I can tell my pain level was down today.
We have a patient who's had shoulder surgery, left shoulder surgery, several herniations in the neck and in the low back. We're going to be working on we increased the range of motion in the left shoulder. We're going to work on working more on the left shoulder today. Oh, that was good. Now this is the real restricted shoulder. Oh yeah. Technique here. Okay. T2, T4. I'd say increased range of motion 10%. Increased range of motion, still guarding, but increased. There goes the ankle. A little bit more. There we go. We have more improvement in the left shoulder, internal and external rotation. We have more improvement in hip extension, hip flexion, and abduction. We also have movement in the lumbar spine, which was unable to be achieved while she was awake. Anterior pelvis moved very well. We've got cavitation on all those areas that I've been having difficulty in regular practice. So we definitely have marked improvement on day 2, at least by 20 to 30%.
How do you feel now compared to when you came in?
Much better, much better.
What's changed?
Can get out of bed without feeling like I'm not sure if I'm going to be able, my feet are going to be able to hold me, and I slept through the night last night for the first time in I don't know how long. So, better sleeping habits, and
How about pain?
pain levels down considerably.
Because you were way up there, right?
I was at about a 7, yes.
So what
I'm down to probably a 2.
The patient has a marked improvement in her shoulder, which had a previous shoulder surgery, virtually no pain. Left arm is a little sore, but there's the radiating pain down the left leg from the low back, but just basically upon laying down. She does have a couple of herniations in the low back, a couple of herniations in the neck, failed shoulder surgery, which is marked improvement, so we're going to be working more extensively on basically the left side. There's C4 on the right side. That's good. Go right into flexion.
Range of motion and lateral bending is improved on both sides. You gotta have a battery control.
Oh yeah, I'm going to do it. I feel like crepitus.
Yep.
Yeah,
Good.
There we go. Okay, that's good.
There goes the talus.
Count of 3, both of you together.
1, 2, 3.
Right. That's right, that's what it was.
Success. Marked improvement in the left shoulder, left scapula, had trigger points, moderate trigger points. They've 90 to 95% improved. Internal, external rotation on the shoulders definitely improved. Low back, had pain radiate down the back of the leg. We got movement out of the left SI joint and the piriformis. And finally, we took care of the TMJ, and as you can see, it just a sigh of relief.
Since I've been able to have the MUA done, with being able to work with this stuff, I've been able to move around a lot easier. Pain is pretty well gone, just trying to get my muscles back into shape. And it's just been wonderful to be able to get back into doing the things that I enjoy doing the most outside. And since then, I've been able to get back to working as a volunteer. Spent 7 hours up at our church doing raking and cutting trees and stuff like that last weekend. And this weekend, I'm able to work with Habitat for Humanity for building a house and letting other people move on with their lives too.